Over to you, Dr. Jones.
Thank you so much for those quotes. You always do such a great job, Dr. Pogue, reminding us of our why and why we have such discussions. So we've prepared a really great discussion for all of us today with our two guest speakers, as you can see on the slide. I would like to introduce you to Dr. Sharian Wrights, MD. Sharian Wrights is a native Atlantan and product of the DeKalb County school system. After high school graduation, she attended and graduated from Brenau University with a Bachelor's of Arts in Biology in 1998. During her tenure at Brenau, she studied the prevalence and prevention of HIV among women in Zimbabwe. In 2002, she graduated from the Medical College of Georgia, now Augusta University, as a National Institute of Health scholar with the intention to work in public health. She completed her residency in pediatrics in 2005 and has been practicing pediatric medicine for 16 years. Dr. Wrights is currently employed by Mobile County Health Department, which is federally qualified health center that primarily serves underserved communities. She is married to Dr. Bobby Wrights and is the devoted mother to 4 children. Our other speaker today, please welcome Ms. Nicasia Davis. Nicasia Davis received her undergraduate degree at North Carolina Central University and Duke University. After completing her matriculation, I'm not speaking well today, I apologize. She went on to graduate school at Virginia State University, completing her master's in clinical psychology in 2011. Her career has taken her from the school system to the correctional environment. In 2015, she was presented with the opportunity to pursue a master's in social work from Alabama Agricultural and Mechanical University. She graduated in 2017 and was licensed as a licensed master social worker. Since 2005, she has participated as a research assistant on University of Virginia neuropsychological study on the effectiveness of the MACE in combat with the U.S. Army at Fort Lee, Virginia. She has participated in the development of the father-daughter dance held annually at the Richmond City Jail. During her time in Virginia DOC, she was one of the first psychological associates to introduce the matrix model of treatment to the treatment environment. In 2017, she began managing the Homicide Survivors Program and sat on the North Alabama Task Force for Human Trafficking in the Blue Light Campaign. Nicasia recently relocated back to her hometown in North Carolina and recently started on launching her nonprofit to address the mental health in rural Eastern North Carolina. When she is not advocating for mental health awareness, adequate mental health treatment for the underserved, she can be found dancing or playing in her garden or planning events and weddings under her company, I Wed Events Incorporated. I just want to extend all of our thanks to our 2 guest speakers. And without more delay, let's get into our great conversation today.
Thank you, Dr. Jones. We appreciate it, and we're just so excited that all of you are here. And we appreciate the time that you took to come, and let's have a conversation about parenting during COVID. Let me just say on the onset that I've been going in and out, and so if my computer should freeze, Dr. Pogue will take over, and from there. Dr. Wrights, thank you for being with us. We'd like to invite you to share some of your insights from a physician's point of view, and also a person who's mothering 5 children, one of whom is under the eligible age for vaccination. To the participants in the audience, we invite you to share your questions in the chat, and then when we have a time for pause, if you would like to unmute yourselves and ask the questions, we would enjoy that and invite that. Just in general, Dr. Wrights, can you help us understand the real dangers associated with how contagious this Delta variant is?
Hey, thanks for having me. But first, I'd like to say that the initial wave of COVID with the Alpha variant was not very challenging.
Dr. Wrights?
Can you hear me?
Now we can.
Oh, I was going to say that the initial wave of COVID, the Alpha variant, was not particularly challenging for me as a clinician on the front line because it didn't affect children quite as much as this variant has. So maybe I would get one patient a week. And keep in mind, although I'm not frontline in terms of in an ER or in an urgent care setting, I say I'm probably third line, wherein all the primary care setting complaints come to me. So I would say maybe one every now and then, one every 2 weeks, I would get a positive COVID, or I'd have a patient come back from the emergency room or urgent care who had a positive COVID. I'm getting positive results every day. Our ICU is full, and our pediatric ICU is full, I should say. And I really just don't think people are taking the ramifications seriously. So I would say that now, in comparison to before, there is an uptick in not only the number of positive cases as far as pediatrics is concerned, but also the severity of symptoms in pediatric cases.
Just to give us an idea as to what you're dealing with, do you have any very poignant stories that you can share? A couple of poignant stories?
I can give one in particular, but this relates to early on, before we were even consistently screening for COVID, because we didn't have the test initially. And that patient, he was an 8-year-old Asian male who came in and complained about vomiting and diarrhea. And it just seemed like a stomach virus, not anything particularly outside the realm of normal. He did complain about a little bit of chest pain. All his vitals were normal. Everything on exam was normal. But I would say 2 days later, he complained of worsening chest pain. He ended up he was life flighted 2 states over because they didn't have the capability to deal with what he had here, and he ended up in heart failure. He now, a year and a half later, still has 3rd-degree heart block. He had a pacemaker in when he was in the hospital that was removed, but he still has some degree of heart failure as well. So the challenge right now is that he had a viral case of heart attack. Let me boil it down that way. And he still has some lingering heart defects as a result of that scenario back in February of last year. As a result, he's still compromised. So I'm struggling with the school and with his parents to understand the importance of him not being exposed again. I really honestly do not think his system would be able to sustain another injury that's akin to the previous one that he had. But I'm fighting, number one, with parents who work every day, who have nowhere for him to go. And I'm fighting also with the school, because they're enforcing PE rules for a child who doesn't have the capacity to run, to jump, who is a silent, quiet kid who's not gonna say, my chest is hurting. I'm hurting, I can't run, I can't keep up. So it's far reaching in ways that I don't think people are always aware of.
That's an excellent segue to the next question. You said that it's far reaching. What do parents really need to know about the virus in younger children? Because before, like you say, younger children weren't affected that early.
So I think your question was, what's important to know about how this virus is affecting younger patients now in comparison to previously?
Exactly.
And I would say they're getting more respiratory symptoms now than they had previously. Previously, respiratory symptoms were pretty much isolated to adult cases and worsening respiratory symptoms in elderly adult patients. Now our ICU, our pediatric ICU is filled with infants. I think the youngest is 2 months old, up to 11, 12 years old that are on a ventilator. So they are actively having respiratory symptoms wherein they have more cardiac defects and what was called multi-system inflammatory symptoms previously.
Have been vaccinated except the one who's underage. How do you work with or convince parents who have children about the vaccine? What's your technique? What's your strategy?
Parents, I find that parents are stratified into probably 3 different categories. They're the parents who are eager to have their children vaccinated, either because their children have medical problems that would be complicated by the virus, or because they themselves have medical problems that would be complicated by exposure to the virus. I find there are some in an in-between category who can be talked to, discussed with, rationalized with, that I can pull over to my vaccine side. And then I have another subset of parents who are hardcore entrenched in conspiracy theories and misinformation. And those parents are almost impossible to even have a rational conversation with. So for those that are in that middle ground, I find that more than numbers or statistics or websites that they can get information from, they receive information better from my personal experience. So if I say I have 5 children, 4 of them are eligible for vaccine, and I've lined all 4 of them up, they all got it, they were all fine. I told them what the side effects that we experienced as a family, what those side effects were. And I find that that influences more than anything else in terms of discussing vaccine hesitancy in families.
And then what do you say when they say, well, people can still get sick even though they've had the COVID vaccine?
Yes, I hear that frequently as well. And the analogy that I heard that I think is most apropos is that when you wear a seatbelt in the car, a seatbelt doesn't prevent you from getting into an accident. The same theory applies in relation to vaccination. Getting the vaccine won't necessarily prevent you from having the disease, but what it will do is prevent you from having worsening symptoms or dying. So the seatbelt, it's not going to keep you from an accident, but your likelihood of having death and dismemberment increases exponentially without a seatbelt. Same is true as far as the COVID vaccination is concerned.
Okay, thank you. Let's pause for just a minute to see if there are any questions from the audience. And you can feel free to place your questions in the chat.
Actually have a question for Dr. Wright. I really appreciate the beginning of this conversation. I look forward to hearing what Ms. Davis has to say about the mental aspect of this. But I want to actually go to your point about what you said, the kind of 3, categories that you find the parents in, and the consequence of that third group, right? That it's so those who are so entrenched in conspiracy theories, as an educator, what advice do you have, not only just for parents but as educators, about how to teach critical analysis, critical thinking to students who are, and I'm not necessarily disparaging parents, but you're already coming from a place of misinformation, right? That and then you're trying to go to school and give people, hopefully not misinformation, facts or whatever the case may be. How do we make sense of the world that we're in, dealing with that third category? They're sending children or their children into school buildings where we want children to have some baseline of facts, have some baseline of critical analysis, some baseline of this didn't happen, this did happen. Can you speak more, not only as a practitioner, but also as a parent, of how do we make sense of this world? Because what I don't want to do is, as an educator myself, I don't want to dismiss particularly the students who are coming from this kind of misinformation world as you know, a lost case or whatever the case may be. And I'm not suggesting we do that, but I'm just saying what are some of the best practices that you can advise. And I also like to get Ms. Davis' point about that as well.
From my standpoint, I think it's so crucial that teachers across all curriculum, age range, teach kids what are credible sources versus what are not credible sources. If you are at home and on YouTube and on Facebook, that is not a credible source. I had a parent email me just yesterday, sent me a video of a physician who had credentials longer than I've been alive. And he was convincing people that vaccinations are poison, how many people have died from being vaccinated. His numbers were skewed and his perspective was off. And he lied. The first thing he said was that he was a professor at Baylor University, and he's been fired from Baylor University. So I told the parent, I said, look, the first thing you need to do is look into the person who is the so-called expert. If their credentials don't line up with who they say they are and where they say they're from, you automatically turn off the video, because you automatically know that anything thereafter is probably fraudulent, because they're not even who they say they are. So I think from the students' perspective, and students frequently can convince their parents into doing what's best, especially when I'm talking about adolescents, 12, 13, 14, 15, they can talk their parents into what they want to have done. I have parents say, well, I'm not going to get it, but she can decide for herself. So I think it's so crucial as educators that we teach children what credible sources are and how to research information that's valid for themselves. They're already looking. So teach them what is credible versus what is not credible.
Ms. Davis?
Absolutely. I agree with Dr. Wright. The one thing I've seen previously in education and currently with some of my current clients is children are a lot more astute than we give them credit for. So we have to allow them that credibility and educate them on, hey, YouTube, not necessarily the best place to find facts. If you have a doctor, talk to your doctor. They can present you with the evidence-based information that they know, because this is what they do. And also kind of validate some of their fears, because the pandemic is something that 99% of the world has never experienced on this level. So their fears of, I don't know, or I don't know what information to trust in this age of disinformation and misinformation, of saying, we understand your fear. Here are some resources that you can utilize to get more information. And that's going to be our best way, especially dealing with children going forward, in order to combat this, is validating a child's fear and going, okay, I can give your parents this information and let y'all talk about it together talk about it with your doctor, ask your doctor questions, so that you can make the best decisions going forward.
Thank you. Do we have any questions in the chat?
Yes, Dr. Croft. I want to come back to that validation, Ms. Davis, but we have two questions, and I'll just read Marilyn Jackson's question first, and y'all can answer that, and then I'll come back and read Ms. Meredith Stewart's question. So the first question is, what can the medical community do to reach the schools in terms of dispelling the misinformation as they receive? And so you talked about, sources, but I guess this question is directly talking about what can the medical community do for schools to reach the terms of dispelling the misinformation that they receive. So can you all answer that one in any order, Ms. Davis or Dr. Wright, however you want to go?
From my standpoint, I work for the Mobile County Health Department, which is the authority in terms of the numbers and what's going on with COVID in our county, in our community. And we as an institution put out weekly, probably twice a week, updates in terms of where our numbers are, who's being hospitalized, who's being affected, what the symptoms are. So I think putting out information regularly is important. But I also think that we need a liaison with the nursing staff at the school. So the head of the nurses who are actually physically in place at school. Because right now I'm having issues with parents who don't believe what I'm telling them. Hey, you're positive. You need to be home and quarantine for 10 to 14 days, da, 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 da. And they're sending kids back to school. So before their quarantine is over, potentially affecting other children. So we need to push a little bit harder. And I'm straddling a line because on one end, I can't breach patient confidentiality. But on the other end, we're talking about a public health crisis if you're sending children to school sick. And you don't know who has leukemia, who's next to you at the table next to you. You don't know who has lupus, who sat at the same lunch chair that you did the period before, who you're putting their actual lives in danger, even to a greater extent than just getting COVID by itself. So I have talked to our legal team just Friday so that we can come together with the nursing department at the school so that there can be some kind of liaison. Hey, you have some positives, you need to contact trace, you need to make sure they're not coming back before their actual quarantine date. But like I said, I'm towing some lines as far as confidentiality is concerned. So that's something we have to work out legally. But I feel like there should be some collaborative conversation going on between the medical staff and the nurses at the school.
Right. Ms. Davis, you got anything to add to that question?
So one of the resources that I have given other colleagues that work in the school system on how to address COVID and grief and things of that nature, especially with elementary age children, is Sesame Street. So Sesame Street for years has offered age appropriate ways to discuss things like someone being sick or a classmate having cancer or a classmate dying or parents dying. And now since the pandemic has started, they have created resources for age appropriate resources to address COVID and hygiene and things of that nature, because those are things that are extremely prevalent going back into the school, is making sure kids know how to wash their hands, and after you touch something, make sure you use hand sanitizer, and how to keep on your mask even when you're uncomfortable, because children, like adults, may not necessarily wash their hands every time they touch something or they sneeze. We all know children can be little drip they carry germs. We've seen it before where one child gets a common cold in the classroom, and next thing you know, within 2 or 3 weeks, it takes down the whole classroom. So we definitely Sesame Street is a great age appropriate resource for elementary age children. And then there are different resources to address your middle school and your high school students. And that's where some of those YouTube channels can come in handy, but they have to be vetted which is extremely important as well.
That vetting, I harp on that in class all the time. I'm glad you brought that up, Ms. Davis. So this is a great segue into what you just said, Ms. Davis, about the like best practices. But before we get to that one, Mr. Roland Wallace noted that COVID-19 can be a strategic science project for every youth. So I appreciate that idea, and maybe we could, get more, details about how to, for all the educators online. Mr. Wallace, if you want to unmute in a couple minutes to kind of, be more detailed about that. So the question from Miss Meredith Stewart is, what advice would you give parents whose children are going to school and involved in activities to limit exposure as much as possible besides masking and hand washing / sanitizing regularly? Are there any other best practices that you know of that parents can implement?
Vaccination.
Okay. So for those vaccination for the adults and vaccination for kids who are vaccine eligible.
Yes, and early on, I was cautious. I didn't want to push a vaccine that I didn't have complete confidence in. So I would let them know that it was available, but I needed to look at the numbers myself. I need to go through all the incidental findings, who got what, how, when. And, you know, anybody who's kept up with those things, young males were coming up with some cardiomyopathies, especially in Israel, their numbers were looking a little convincing. And I talked to my folks in the emergency room. I talked to my people all over the place, and I can confidently say, hey, you are better off getting this vaccine than just wilding out and seeing how it's going to go. And in answer, if anybody's looking at those numbers, I can say that your likelihood of getting COVID and having a heart defect that is not reversible is higher getting COVID than you are with the vaccine. And the vaccine, all those young males who did have those cardiomyopathies, they reversed. And so you're talking about a difference between having a temporary issue and having a potentially permanent issue. So, yeah, the other things that I tell them, you know, just to be clear and put my little punch in there, redness and swelling, fever for maybe a day or two, a little bit of enlarged lymph node up under the arm, but that's about the most that I've seen. So I just say, please, if you really want to cover all your bases, get them vaccinated. That way you can have some confidence. I'm speaking as somebody whose kids are in multiple sports, multiple kids, and one of them cannot be vaccinated. So my comfort level with her is a little bit less than the other children. And yes, we push masks, but I'm also more comfortable and confident when we're talking about outdoor activities. So if you're telling me they're running track versus I'm playing basketball indoors, then your safest bet is the track. But I will say also that I have noticed that, and I've heard some numbers, that a lot of college level and high school sports coaches are pushing for their teams to be vaccinated. So I want to say like Ole Miss has 100% vaccination rate. Alabama, you know, that's where I am. They have like 90% vaccination rate. So look at the folks around you who are trying to be elite athletes, who are competing on an elite level, and see what they're doing as well to protect themselves. That's what I tell my kids, because sometimes those celebrities or the people that they look up to make a greater impact than just little old me saying, hey, you need to get vaccinated. So I just wanted to point that out as well.
So even a medical doctor got to get validation.
You got to have backup. You got to have backup.
Dr. Willis, we have just one more set of questions, and then we will open it up again for the chat and for open questions. Okay?
Okay, no problem.
All right. So we wanted to know, how are you, Ms. Davis and Dr. Rice, how are you dealing with this? I think that's a question that came up with Dr. Willis. At the end of the day, you all are dealing with this and dealing with COVID. But in your case, Dr. Rice, you took the Hippocratic Oath. How do you feel about those who didn't get vaccinated, and how are you feeling on a day-to-day basis with what you are incurring? And can you refuse treatment from a patient?
So there's so many landmines with that question. So I am personally frustrated and tired. Period. But when you're talking about children, that's why I went into pediatrics, because they frequently don't have choices. They're governed by the people who care for them. So my compassion for my patients is still there to a great degree, because I know that they're influenced by the people who are taking care of them, and they don't always have the same number of choices that adults do. Now, I have to say, my patience for adults, when I hear my husband on phone calls at night or when he goes in to see them on the weekend, my patience for them is slim, because everybody is on this bandwagon of anti-vax and my personal rights and whatnot until your own event. And then all of a sudden, 100% of those anti-vaxxers are no longer anti-vaxxers, and then they want to tell everybody else what they should do and what they should have done. So my patience for them is a little bit on the waning side, I would say. However, because I do not take care of them, it doesn't affect my professional day to day.
Okay, thanks. All right. This
So I
is
want a different end.
Well, hold on, Miss Dr. Crop, Miss Davis didn't answer the question.
okay. All right.
So I currently serve adults, and in some cases they have children. And it is extremely, Dr. Wright said she's tired. I am exhausted. From the, oh, I'm not giving my kid a shot, to, ma'am, we now have to talk about you planning your child's funeral. Or we now have to talk about how to get long-term care into the home for your child. Or if you're a single parent, how are you now going to manage raising your children when you can barely get out of bed just to make a bowl of cereal after COVID? And addressing the child's anxiety of, well, I can't see grandma because I might get grandma sick. And those are putting burdens on children that people are not thinking about. It's one thing for an adult to say, I'm not going to take the vaccine because it's putting a microchip in my arm, versus a kid feeling like they got grandma sick because they went to school, or they played in a basketball game, or they played in a football game, and now grandma is on a vent. And children don't, depending on the age of the child, they don't necessarily have the thought process to go, it may not have been me, it may have been grandma just being old. Where I saw grandma on Sunday, and then by the following Sunday, I couldn't see grandma because grandma's in the hospital. So I am exhausted of trying to explain and trying to help coax those anxieties and those fears of fear and those fears of depression that some parents don't recognize that children have.
I can understand that. And even those of us who are not on the front line like you and Dr. Rice, we're exhausted from being exhausted. So I know how tired you all must be. But this is an excellent segue, and I'll turn it over to Dr. Pogue to talk about this trauma that we know children and adults are experiencing, but supposedly, since children don't have the coping mechanisms of the adults, I'll turn it over to Dr. Pogue.
And I'll turn it right over to Dr. Jones. She has that section.
Okay, thank you. We do have another.
I was gonna go with the flow. Yes, I am riveted by this part of the conversation, because I feel like so often we don't talk about the mental scars and how that affects all of us, whether we're the one getting sick, whether we're the one taking care of someone getting sick. And so that brings us to our next set of questions for Ms. Nicasia Davis, who is a therapist and licensed master social worker. So we have been talking about the long-term mental health effects of the virus. First, we'd like to ask, what, if any, long-term effects or signs of trauma have you identified in children caused by the virus, and what should we look for?
Well, I've definitely seen increased anxiety of, I want to have friends, but I don't want to spend time with my friends because my friends might be sick and they might get me sick. The depressive state that the depression has increased amongst children because of the isolation of, I went from being able to be around my friends in school to being at home, not really being able to go anywhere or do anything. As well as I've seen an increase in substance use with especially teenagers, because they're in a space of In some cases, they were sophomores in school and now they're seniors and they're preparing to graduate and go into a college environment, and they missed an entire school year, where they've missed those hallmark moments of school, of high school. Um, I've seen an increase of traumatic responses of the first time someone coughs, from say simple allergies to a complete meltdown, because they've not been necessarily taught how to address their fears related to the pandemic, as well as they've not been educated on what the pandemic actually is, um, as well as traumatic responses related to grief. Because the one thing in American society we don't talk about when it comes to or with children is death. We gloss over it very, very well by using words like grandma passed away or grandma is sleeping. And those make children react differently, depending on how old they are.
Thank you so much for that. I think that there's a lot in there that we can be looking for in young children than, like you said, might not have thought about ahead of time. At this time, I would like to turn to the chat.
Amber,
Yes.
can I add that because of the depression and staying at home, and which I've seen quite a bit of that, I don't even have enough services to refer kids to that are having complaints of depression and anxiety. But they also are at home and they are coping in maladaptive ways, other than, in addition to the substance abuse. I have so many who have tipped over very far into the obesity scale because they don't have anything to do. They can't do anything. They're not going out. And I have kids I have 2 new onset diabetics in the last 2 months, just because their weights have skyrocketed to the point where their mechanisms aren't coping anymore. So I just want to say that all of these things are interconnected. The mental health, in addition to their physical health, is all revolving. And one other thing I'd like to add is that academically, my kids are suffering. Mm-hmm. Everybody doesn't respond well to online school. And a lot of my kindergartners, they miss crucial time periods and they cannot read. They cannot put the letters together. They're being held back. And teachers are jumping into wherever they left off, instead of going back and reviewing what they might have missed out on. So now I've got a kid who is suffering academically in addition to all the social concerns. And you can't look in a kid's face and not appreciate the esteem hit that it takes when they're being held back, the esteem hit that it takes when other students can read and I can't read. It is demoralizing for these kids. And so academically, physically, emotionally, they're taking hits all over the place. And I just want to put a plug in for the kids who are at home with parents who cannot cope. And so they end up in increased risk of abuse because the parents can't cope. And so school was their primary, escape. That's where they ate 2 times a day. That's where somebody acted like they cared about them. And so because I primarily take care of underserved populations, I probably see that probably more than maybe someone else, but it's far reaching. There are ripples that go way beyond just, are you going to get sick or are you not going to get sick? Mm-hmm. I just want to put in a plug for that.
To piggyback on Dr. Wright, there has been almost a 100% increase in child abuse reports across the nation, because children during the school year, there were eyes on a child to see on a daily basis, to see a bruise. That bruise wasn't there on Monday, but now you have a bruise on your arm on Wednesday. To see the neglect that has happened, now those eyes aren't there. And so it makes abusive situations a little bit easier to hide and a lot harder to detect.
Yes, thank you for pointing out those very, very important things that, um, because of exactly what you said, it's easier to hide, it's easier to not think about it when there's so many other things to think about. And so that just hit me
Yeah.
definitely. I want to continue to encourage people listening to submit your questions. One thing that I just keep having on my mind as I listen to both of our wonderful speakers is like, what do you do with that hopelessness? Like, especially when we're talking about children who, as we've talked about, don't have the tools to deal with it. How can we give people tools to deal with that kind of hopelessness, to deal with this belief that no one's looking out for their best? Not like there's so much distrust in the medical field and the government. What are some tools we can use to help people with that?
I wish I could say that it is easy in instilling hope, but unfortunately it is not. Especially when you're going to get an hour with a therapist, whether it's a clinical social worker or a mental health counselor. And then you're going to spend the next 6 days until the next time you see them in a hopeless environment where you don't feel like there is hope within that environment. So it's not so easy to say, hey, it's going to get better, because people want to know when. Um, it's not so easy to say, well, if you just use positive affirmations, it'll help your thinking. It's not as easy as YouTube makes it out to be. It's about having those tough conversations of how was your day and actually listening to the child. Um, the same way you want your significant other to listen to you when you talk about your day, we have to give that same energy and attention to our children. Um, and actually listen to them and say, okay, mom and dad understand what you're feeling, because on some level we're feeling the same way. And all we can do is continue to wake up every day and try to do something a little bit different to feel better. Um, it's also about becoming very unconventional in how you do that. Within the Black community, we don't do well with talking about our mental health. We don't do well with addressing it. So we have to be open to getting our children out of the house if we can, getting them into, um, getting them just outside, walking through the woods or going on a nature hike, exploring those free options that many cities use, um, to give them something to look forward to.
Thank you. Dr. Wrights, do you have anything to add to that?
I completely agree with what Natasha is saying. I think that I try to find the safest route for them to be as active as they can. So, like I said, we discussed sports. So if you're gonna do something, let's try some cross country. Let's try, something where you're outside, you're spaced apart, but you're exerting activity. I try to talk about things that are outdoor. I really push outdoor activity, which is, it lends itself well to my environment just because, there are lots of green spaces, there are lots of outdoor sports. Now, if you're talking about somebody someplace else where those things would not lend themselves well, I'm not sure, but that's what I push for: physical activity, outdoor physical activity. And I push parents to advocate for their children past getting failure notifications. So I push parents, hey, you need to engage with the teacher. If she's not emailing you back, talk to the next person. If the child is this is their second year failing, then now we need to push for evaluation through special ed. Let's get a whole psycho ed evaluation so we can see if there's a learning disability. So I'm always about trying to find some level of solution in whatever environment we have. And so I know that I have parents that I see that they're on the edge, that they're not doing well. So I tell them, especially if they have infants, small ones, hey, that baby's okay in that crib crying for about 20, 30 minutes while you take a step outside. If they're fed, changed, clean, it's okay. You know, so that they can carve out a little space for themselves. Because I know when everything was shut down and I was here with 5 kids, I was like, OMG, I am not a teacher. I am not equipped for this. And I thought once I went back to work and they were home by themselves, hey, all right, so the oldest ones are gonna look after the little ones. And I got an email every other day that the little one would sleep under the table or hadn't gone to class. The teacher would send home a stack of work like this, and she'd give me a stack like this to send back to the teacher. Like a straight A student automatic is failing. So I'm seeing it from my perspective. My oldest son, who's 16, he said the 12-year-old's depressed. She never gets out of bed. And I went and I said, hey, are you okay? What's going on? And she's like, well, there's nothing else for me to do. I'm watching YouTube. I got my earbuds on. There's nothing else for me to do. So guess what we did? We started cross country. So now you have something to do. And does she love it? No. Is she great at it? No. But that's okay because she's out there and she's participating and she's active. And I see her out of her room just a little bit more than I was before. So, you know, I'm always trying to look for something active for them to engage in, is what I would say.
Mm-hmm.
Thank you so much for those suggestions. Also, thank you to Roland Wallace in the chat, adding that as a learning facilitator, I search within the tragic world and create growth and increasing learning opportunities to deal with the hand that was dealt. I really like that wording that, these are your cards. What are you going to do with them? What can you do with them? And kind of connecting with what Dr. Wrights was saying, like, do something. You might not love it, but do something. And those make a big difference. One more chat question from Ms. Meredith Stewart asking, do either of the panelists believe the eligible age for children to be vaccinated will be lowered?
Yes, it will, but it's a little bit more complicated because they have to check, they're changing the dosages for the younger age. So initially 16 and up, Pfizer could get it, right? And so now they lowered it, 12 and up, Pfizer can get it, but that's all a standard dose. So as they go younger, they're looking at lower dosages. So it takes a little bit more time to tease out what's the dosage that's appropriate that gets you the level of immunity that you're looking for. So yes, I do think they will, but they keep pushing the date back. So initially they were saying 6 to 12 October. So, and then lower than that, maybe the 1st of next year. So that's where the target is right now. But I have found that they keep moving it back just because they need more time to test the dosages and the antibody levels. But I will say this, as soon as they say, okay, my 10-year-old will be in the line to get it, just to take the weight off the back of my neck, that she can be safely in a school environment. And I will say that her school is trying to do everything they can. They did do a mask mandate before anybody else did. They put in new HVAC systems and blah, 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 blah. So, but still, I don't think there's enough spacing between the desks. Still, I worry about when they're eating at the cafeteria. You can't have a mask on when you're eating. And I see these people on Facebook. You've just come back from Disney World and wherever else thinking that nothing is wrong and nothing's happened. So I know I'm wrong. I already know it. But I say, hey, they went someplace. Make sure you stay away from them. Stay away from them.
The one thing I've started telling parents is to educate your child that sharing is no longer caring. Stop sharing stuff. Because think about schools. Children have no issue sharing pencils, pens, crayons, coats, clothes. Just thinking back when I was in the school system, a kid would come in with a coat and leave going home with a different coat and it's not his or hers. So emphasizing that sharing is no longer caring due to the pandemic. Um, and emphasizing that very much of don't share your food, don't share your drinks, don't share your clothes, don't touch. Maintain, hey, you don't have to sit right next to your best friend for them to be your best friend. And that's going to be the strongest message that a parent could possibly give a child going back into the school system. Of wear your mask, wash your hands, and don't share anything, and bring back home your own clothes. Mm-hmm.
Thank you for all of those suggestions. I also would like to invite Mr. Roland Wallace to elaborate a little bit on your strategic science and COVID-19 plan. Maybe that can also help us think of more ideas on learning experiences and opportunities.
Thank you for the opportunity. We've been in this country for 401 years. And when we look at the history of this country, most of what generation before us did, there was no nicety about it. We just took whatever masters threw at us and we made whatever. So my point is, I just need to know what the challenges are. Then I will search within myself and around me to come up with ways to address those challenges, like my father's generation and my father's father's generation did, living in Louisiana. And sorry, folk didn't give them the time of day, but he did all right. He raised me all right. So let's rehearse and go back to our history in terms of tackling whatever circumstance and situation. And children are more capable than we give them credit for. And with that, I thank you.
Thank you so much. Sorry about that. And so we have one more question from the audience. Thank you everyone for contributing. Marilyn Jackson says, some of the initial vaccinations were given in February 2021. After 6 months, it's my understanding that the vaccine is no longer as effective, especially against the variant. What are the next steps for those who are double vaccinated in the early months of the year?
So they're talking about getting booster vaccines now. And as of, I think Friday, the CDC announced that they are advocating for booster vaccines for immunocompromised. And I think that they will continue to expand that, keeping in mind that people who are immunocompromised, elderly, there are certain subgroups of people who don't maintain immunity for the same amount of time as your general population. So I think that's who they will target first. Then they will start talking about when they will extend it. And you got to also keep in mind, we have enough doses in the United States, but they clearly don't have enough doses worldwide. And because we're such an interconnected community globally, if you don't take care of the folks in India, eventually it's going to cycle back around, here. So I think all of those things are in the consideration. How are you going to give people boosters when some people in Bangladesh, let's say, haven't even gotten their first dose? And keeping in mind that these variants, they're going to cycle around the same way that now flu, every year you got to get another shot because it mutates and the strain is different every year. We don't want that to be the case with coronavirus. We don't want that to be the case. So, You know, you got to take care of some of those folks who haven't gotten any vaccines. While we've got vaccines thrown out on the shelves, rotting on the shelves from people refusing, there are some people in other countries who haven't gotten access to that first dose. So, you know, all of those things are in the consideration of when we're talking about when to allot booster doses for which populations.
Thank you. That's so important to keep in mind as we continue this fight, this struggle for our lives. I didn't mean to go dark on that, but on that note, I would like to turn it back over to my colleague, Dr. Tiffany Pogue, for our final questions to wrap up our very, very great informative conversation today.
And before I seek to wrap it up and thank our panelists for being here, I wanted to share some information with you all about TITUS. And so if you bear with me just a moment, I'm going to share some information on the screen. All right, so Teaching in the Urban South, or TITUS, was formed in 2011 among a group of graduate students at Emory University. It's a network of scholars, parents, students, and other community stakeholders seeking to solve the problems that our students face throughout the urban South. And while we identify most explicitly with the urban South, we do believe in the global South. And so we have that diasporic mindset that Dr. Wright just talked about. We are guided by a historical model that honors the pedagogical and justice-oriented practices of Black educators prior to desegregation. We work with community members of all types to solve the problems that our students face in U.S. schools. We value the disruption of problematic representations of our students in our communities. We believe in the academic potential and excellence of Black students in particular, but all urban students and communities. We seek to nurture students as they develop identity, voice, and agency. And we wanted to share our contact information with you. Please send us an email at teachingintheurbansouth@gmail.com to register for our email list, or you can also do so at teachingintheurbansouth.com. Both places you'll be able to sign up for our email list so that you get notices of future town hall events. I can let you know right now that we'll have a forthcoming town hall on laypersons' strategies for research based on our conversations today, because we do want to make sure that people understand media literacy and how to differentiate between fact and fiction when they're sharing information with us. I also want to give you some evaluation instructions. I will put this code in the chat in just a moment, or if you're using your smartphone, you can use the QR code on the screen so that you can evaluate this workshop, give us some ideas about what we can do in the future, and anything else you want to comment to us. Now, I'd like to turn it back over to our panelists and ask each of them to give us words that they'd like to leave us with today.
I would just say that please protect yourselves and protect the people around you. Look out for the children that are around you, and help your fellow man. Don't be quiet. When you hear misinformation being spread, when you hear things that you know are out of line, correct people. Put your 2 cents in there, because we in the medical community are tired. We tired, y'all. So help us get correct information out there.
I would go right along with Dr. Wright's of, if we can't protect our village, who can? And our youngest are our most precious commodities. Because if we can't protect them, no one else will. And listen to them. Listen to their voice. Listen when they say they're not okay. And then use your resources to help them become okay.
Thank you so much to our panelists. Please join me in giving them you can do a virtual chat if you know how to do the reactions here in Zoom, but I want to thank them again. I'm going to remind us of the greeting, how are the children? And the response that we all want to always be able to give is all the children are okay. So thank you all for joining Titus's Town Hall today. We will have more coming in the future. I've put the evaluation link in the chat, so please feel free to give us your results and be honest about it, because we want this to be very informative. We want to serve our community in this way, and we want to invite you to join us in that work if you see so feeling. Thank you again and have a great day.